different types of explanation of what autism is. So as you mentioned, Dr. Ari, Saturday was World Autism Awareness Day, and we are moving towards more of World Autism Acceptance. And sad reality is that as the world is moving to acceptance here in Africa and even in our rural areas, we still don't even have the level of awareness that we need so that we are able to all move forward and find solutions to all the challenges that come with it. So in brief, autism is an umbrella term for developmental conditions that are marked by persistent, ongoing challenges with social, communication, interaction, as well as restricted and repetitive behavior patterns, interests, and activities. Autism-related challenges can range from mild to severe and somewhat from person to person. So everyone on the spectrum is totally different, and with their abilities and disabilities. I'll give an example of I'm a mother of 3, and 2 of my boys are on the autism spectrum, and they're like Turukana and Mombasa in their characteristics, etc. They both share a common comorbid, which is now epilepsy. And you find like the youngest has also ADD to top it, so, and learning challenges, while the middle one you'll find also has a bit of flat foot, which is more of a physical disability that comes with it. And some of these things for us, we don't even understand as caregivers. Now let's start from the point 1, through the delivery process. We go through a lot of things as parents, and as we know, there is no known cause for autism. But the minute we give birth and we notice all these challenges in the behavior and the development of a child, for us, one of the things as a parent, they always say, listen to the mother, they know what they're saying. But what we experience is sometimes whatever you say gets shunned down. And then because the doctor is the pro, we just say, okay, the doctor said so, we let it go. But what I want us to do is pay a bit more of attention. I'll give you an example of my second child. It was CS, failed induction. My, labor, the spacing was coming from 3 minutes, 10, 20, disappears. Second induction, same thing. By the time I went to CS, it was, I think the baby had enough distress. But the point of delivery, since it was CS, I have no idea. Even as early as Saturday, I was being asked, no one took the time to tell me what happened while I was under sedation. So some questions I'm asked now as part of history are still things I can't answer. And sadly, the fact that when my son started getting convulsions at the age of 3 months, I went back to the hospital to ask for the Apgar score, etc. And I'm told my child's file is not there and mine is there. So of course, some things don't add up. And for us, it's already hard enough what we're dealing with, because at that point, my child was having a lot of sensory issues, gastro issues, and even the doctor I was seeing at the point to try and solve all this problem. As a parent, I noticed my son is shaking and he's not cold. And it was a concern I had, but I was told it's a behavior that will go away. And I'm like, okay, doc said so. So by the time we are having a full-blown convulsion, I was thinking my child is going to die. Who do I run to? Do I call the gastroenterologist? Do I call the pediatrician? Do I call the general doctor? And now the questions start coming, what is going on? And now considering like all these issues we've just been on medication one after the other, trying to settle down and discover he was lactose intolerant at that age. And I believe that's the same point at which as the medical fraternity should be like, wait, hold a minute, let's pay closer attention to the development of this child. Fast forward, the convulsion started. What was happening by the time he was 6 months when he had the worst of convulsions? He had started crawling, he had started at least trying to mumble and etc. We lost everything. I ended up with this doll that just stares at you. No reaction, nothing. The movement that he tried to crawl, he's not doing none of that. And no one can explain this. He's not talking. But what is the main assumption we all get to hear as parents? It's a boy, give him time. So we need to change the narrative to like, wait a minute, okay. So he's not talking. You look at the other milestones. Also, the level of awareness with our doctors is one of the things that concerns me. From, as mentioned, I'm the founder of Andy Speaks for Special Needs Persons, where we champion for inclusion of the neurodiverse. In 2019, we did a motorcycle ride through 16 counties, stopping at most government hospitals and engaging doctors on matters of autism. And the shocking bit to me was like, out of a group of like 40 nurses, 30 nurses, you find you only have 3 who have heard about autism. So something is wrong somewhere. And remember, for me as a parent, the first person point of contact is always, oh, the nurse is the one who will check how far, head circumference, etc., then move to the doctor. So if at this point, we only have a very bare minimum percentile that really understands that some of the flags and the red flags to note is the developmental delays in case of autism management and diagnosis, then we really need to do something on the side of it, education. Because I engaged one of my doctors and they said, when it comes to some of these disabilities, it's only a few lessons in your entire course. And I'm like, so how is that supposed to be? You guys go to school for 7 years. How are you going to remember that if it's not a specialty? Yeah, that's one of the other things that we have. And it becomes so hard for a parent to try to understand the myths that we're already facing, the eyes from society when your child is not talking. I remember my son spoke at 5, and those 5 years were not easy. I'm already trying to handle the comorbid of convulsion disorder, being put on medication. I was told wait until he's 5, at least maybe then they might stop. So I am living, counting every day for that day that he will turn 5. And I wish this thing away. And that never happened, you know? So you build, we get moments, we have our hopes out so high up there, then it gets crashed so low. And then also just trying to figure the journey. Because I always like saying that for me, my journey felt like it was in the middle of the night. I got to a forest. I was told there is this forest. I am sorry, there is no lantern, there is no matchbox, there is no map, but I need you to find your way to the other side of this forest safely. That is how it feels when you're navigating the system, when you have a child with special needs. That's our daily life, that's our story. So when you step outside of your world and when we see that parents come to you, they're lost, they're tired, caring for this child is even believed to start. As much as we love them, it's our children, the community itself does not make it any easier. It does not, because your family, first of all, I remember the first thing I was being asked when I was told, oh, your child has autism. Now it becomes, oh, does this exist in your husband's family? Does this exist in your family? Does any of your family members? Yet I am hearing this word for the first time in my entire life. Then it brings that tension in the family unit, because it's like, okay, your people, my people. And remember, you're already dealing with those things of, especially if you have a severely autistic child, the way you are branded that you have a mad child, you have a child who's impaired, your name stops being, let's say, Sylvia, it becomes Mama Ule Mtoto Mwenda Wazimu, Mama Ule Mtoto Mlemavu. We are still individuals at the end of the day. But the most heartbreaking point for us as caregivers, from the conversation I mentioned I have heard, 80% of the time, how does the doctor break it down? How is it told to you that your child is autistic or your child has a disability or what is going on? We're already stressed out enough, but the sad reality is we don't get told. I was last week, but one, I was talking to a parent in Addis, and she just said she was told, oh, your child is autistic, go home or go find a mental facility. What do the two have in common? How do we even base our diagnosis here in Kenya? Do we have a set way of doing it? Who is the qualified person to go to when you suspect that your child could be autistic or there could be something that needs to get done? I have no idea if there is a very set, because these are the questions I get as an advocate every single day and week. I have been told my child is autistic. Where do I go from here? Who do I go to? Which doctors are there? And the sad reality is we are lacking of that database. I know I reached out to some of the doctors' organization and asked for, share with us the qualified doctors who are in line, which if it's occupational therapists, please give us. These are the certified, qualified, because we have sufficient quacks out there taking advantage of caregivers and saying that they are speech and OT and all these therapists just because they went online for 3 weeks and did a course and got a certification. But that's not how it's supposed to work. We need people who really, really understand what our kids are. Look at the numbers of the doctors we have available in this specific space. I can name them, like the ones that I know. You know, we've had issues about paying attention to the details of how we break it down. The process we go through as parents shifts. The minute you tell me, oh, your child is autistic, I've just had that word for the first time. Trust you me, I am blank. The first person I'll reach to is Dr. Google, who will kill me even more. So all we are asking for you as the doctors fraternity and the medical space, just break it down to me nice and slowly. Your child is autistic. Autism is XYZ. It's not contagious. It's not a death sentence. Then where do I go from there? Guide me, walk this journey with me, you know. Tell me, okay, so you will need to start with, according to what you can see as a doctor, do I need OT first, or do I need, do I need occupational therapy first? Let me stop using jargon. Or do I need speech therapy first? Do I need psychosocial support? Because sometimes you tell me I need to see a psychiatrist, and I ask myself, does my child have a mental issue? You know, when we're saying that, okay, we have, there is psychiatrists and psychologists. I know those two always get me mixed up, but that always throws you back to like, okay, do I have a retarded child? I know that's a word that we don't like hearing, but I'm being raw as to how this news lands to us when you're told such things. So it's easy, just tell me, okay, these are the issues that we have. This is how we expect our expectations. Also, just help us manage the expectations. If there are comorbid conditions you have seen, inform us, let us know that expect this as the child grows. For me personally, I'm getting to teenage, I'm seeing behavior and reactions. We are nonverbal, but we get frustrated, we start throwing things, and I'm like, okay, so am I dealing with teenage? How do I deal with these teenage hormone changes and the fact that autism is there? I had a parent who reached out and said the minute we hit teenage, the child stopped talking, started locking himself up. How do they even start from there? I was asked a tough question yesterday by child is in their head. Who do I go to? Can I get a psychiatrist? I'm like, it's not a psychiatrist issue. You know, so there is general education and information that really, really needs to be brought down and taken to the parents in a simple, empathetic way. Because from all the feedback that I got, that is one of the top things. The way that a doctor will just tell you, oh, your child is autistic. Okay, my job is done. Go find, you know, a neurologist maybe. But remember, neurologists are only handling the ones who have the epileptic comorbid. How many developmental pediatricians do we have? I know two. You know, how many specialists do we have that can actually just generally prescribe correctly the anticonvulsants? Because sometimes, even as a parent, I see when we're doing the medical support, because during COVID, parents could not afford medication. And it was such a sad state that some of the medication we are using as a country have been banned outside. So why are we doing this to our children? That is a question I ask myself, and I would like to pose the same to you. I know it is cheap, it is an option, but if it has side effects, why are we exposing our children to it? If the West is also banned, we are the ones who are consuming it. Why are we allowing ourselves to be in that space? And even when we're doing the adjustments of medication, explain to me, I'm giving this medication because of this. I'm giving 2 of them because this works best with this. Expect certain side effects. How many times in the cerebral palsy group do we find? Because we all share the same woes. You see, my medication was adjusted. My child is not sleeping. They're screaming the whole night. They're not eating. It would only be courtesy the doctor to tell you, expect this kind of behavior because of changes, because of either withdrawal when you're reducing to amend. It's just something that we just need the bare minimum support, information, is the bare minimum support that we can get. Because remember, sometimes your hands are full. If you have a fully dependent child, it becomes very, very hard. And sometimes people say people with disabilities are poor. I would like to change that notion. Disability is expensive, very, very expensive. I did a survey in 2020 across parents and asked them, how much do you spend? Okay, let's break it down. I'll take myself, I'll take my children, for example. Andrew needs speech therapy, occupational therapy. I have to see the neurologist at least every quarter now, but earlier, of course, it was almost monthly. How many insurance covers will cater for that? Even NHIF itself does not give us support for therapy. So that means I have to go back to my pocket. When I'm being told I have to take them for OT, that means I have to leave work and take this child. And then people ask you why you're not working. Which employer will allow you three sessions for all the services for you to leave every other time? And of course, there is working hours, then there is no working hours. Not everyone is available. So this is our reality. We just have to adjust. So you can imagine with that, even as much as we're saying free primary school or free education here and there, there's nothing free for us. There is nothing free for us, because I will be paying, I'll be told, oh, special education, you need to pay extra because you have to have a shadow teacher. You need to pay extra because you have to have a nutritional, intervention and etc. All that in one person. And the sad reality also, to top it up, most of us are singles. Not all men will stick around when they can see. It becomes, remember when I said about the stigma, it becomes you woman, your people, your problems, I'm out. They have an option of getting married again. For us, we have to stick it through with our children. It's our children. We will take them for however they are, and we can do anything for them. But we are dying in the process. How many of us have depression? No one to talk to. Because remember, everyone has shunned you because they think that child is weird. Because the pain that is shown to our children, then they're pure of heart. They don't feel it, they don't say it. I've seen my son being rejected, I've seen my son being laughed at, but he doesn't notice it, but it kills me as a parent. It kills me when I see people treating him that way. And sometimes it's an opportunity to advocate, but sometimes you don't even have that energy. Maybe you never slept. Maybe you've had convulsions throughout the night. Maybe, all these other things. There's those who are still in diapers, those who are headbangers. You're worried about all these things. So it be this fight no more. That's where life pushes you to that point. So when we come to the doctors, at least we are looking at a safe space of someone who understands what I'm going through, but that's not what we are met with. I will give you my example. I was changing doctors because insurance said I can't use this doctor anymore. I have to go to Dr. B. And Dr. B, who's very well reputed, asked, when was the last time you gave medicine to your child? I'm like, I couldn't afford it, and you end up in hospital, of course, with epilepsy. But the sad reality is when I came and I said I couldn't afford it to buy it from that specific hospital, and that time was running out. It was a choice I had to make, either go for review or buy the medicine. It's not that I want to. I was at a point I simply could not afford it. It was either food or rent or medicine or survival. I have other kids, so you have to make such tough choices. But the thing that killed me the most, and I swore not to go back, the problem is I was told, so what are you doing here? I'm like, this is a doctor telling me what I'm doing there. I've just opened my inner space and told you I cannot afford. What options are there? And when my son 1 week later got admitted in hospital, the doctor refused to come. I'm paying for a service, but a doctor did not come to see my child. And that, I think, is one of the only few things in my life I can never forgive. If there is any person in life that has ever done anything in this space of special needs parenting that tore me to the core, was those statements by the doctor, and that action of my child is 1 minute walk from your office next door. to the ward and you still did not show up. Just show up. No one asked you for a lot. Do your job. You're being paid to do it. So sometimes when a parent also comes and we're like, I just need to go, because I know you offer therapy, we get appointments, we wish that appointments could just be appointments. Tell me come at 10, let me come at 10. My child cannot sit still for more than 20 minutes, half. By the time I'm coming in, you'll even misdiagnose because you will not be able to look at them, to pay attention, to see the right thing, because he's tired from waiting. I know there is that scarcity for neurologists that we have people traveling overnight. You're already changing and disrupting a child's environment to come and sit a whole day outside the doctor's office to be seen at 1 a.m., midnight, 9 p.m., you know, and it's a sacrifice they have to make. So as a fraternity, we can look at how do we resolve this issue of the scarcity of professionals who can support. How do you come together? Sometimes you run to one doctor because every time I think I need to see my neurologist, that's another 5,000. Maybe I'm only earning 20K. I have to pay all these other things and still go see this doctor. So it's a choice. Some stay with their kids at home and not go for review over a very long time. And you find that that will have its own side effects. It will have its own side effects. So I'm choosing life versus existing. Do I have them or do I help them, you know, sustain? We get to experience all this, and all we're saying is, who do we run to if the people who are supposed to be working with us are not there? Because you find that when I was doing the research before I started Andy Speaks, I remember I went to the UK, my sister is there, her child has Down syndrome. And I took it as a way to learn and see how they do it. I got an opportunity to go there at a very opportune time because the schools were closing, they were having their IEP. And I see the paperwork was sent before, like the doctor sent their report, the social services lady shared their report, the ophthalmologist shared their report, the neurologist shared their report. And I'm like, what is all this? She's like, yeah, everyone who's taking care of this child has sent their report, their plan of what they're doing and how it is going. You know, they're working as a team, all of them, to make sure that this child can actually move. Remember, this is and also, and I look at it and I look at what we have here in our country, and I'm like, I go to my doctor, I deal with my doctor, I go to the is doing their own thing, and the left hand and the right hand don't even know what they're doing. Always is there a way we can formulate that this child is under doctor so and so, so and so. This is the team. This is the family that is ensuring. I know there is sometimes a lot to do looking at the numbers, but we're looking forward to how do we make our country better, inclusive, integrated. How do we build that acceptance and love? Because for me as a parent, if I don't get that support, sometimes there's jargon that is used. I have no idea. I don't know who I start asking, you know, and it's just a report. And if I go, like I said, we all start asking, have you been through this? Have you been through this? Their experience is not like mine. My child is not like theirs. We're just trying to hold each other's hand because that is the best we can do as at now, as caregivers. Even looking as much as this appointment has come to try and push for policies. We push for policies, but how many people listen? We are signatories to SDGs. What does that mean? Has that been escalated downwards to ensure there is equality, to ensure there is equity, to ensure that the hospitals have what it is that they need? Even in your hospital, in the neurological side, do you have a waiting area with either, let's say, a dark room or even an imitation of a dark room, or toys that are very friendly to the autistic society? That's what we call equity. That's what we call being considerate. They're not the same like everyone else. And you as a doctor, I'm sure you know, if I put this, it will make their life easier. If you understand that the lines are going to be long, if I have this in place, we're going to have a better experience, because sometimes going to the doctors becomes a nightmare. I remember for me, I would not go alone. I would rather call my mother to take her day off that day, or even call a friend, which you know is very, very It's like water in the desert, finding someone who will quit to come and go through this stress with you. But the challenge is, especially for us who have multiple children on the spectrum, you can't, you run dry. By the time I'm walking in, you're asking me questions. I am tired, mentally, physically exhausted. Let's take that to the side of you need to do an X-ray. You tell me, starve this child because you have to do a procedure. One, how do I start telling someone who lives on a routine that they cannot eat? That is double trouble for me. That means I will not even have peace when you amend any of these things. All right, let's think about sleeping. You need to do an X-ray. We know some of them are hyper. It's one of the comorbid. It's either ADD, ADHD, all of those hyperactivities can be part of it. For you as a doctor, be gentle. That's it. Not even this is telling you like, I can't do this if you can't keep them calm. I'm not God to keep this person calm. I already have enough drama with neighbors complaining about screaming, etc., to start saying, okay, I'm going to the doctor, they need to make him sleep. And some things just be accommodative. Explain to me. It's either I use melatonin, okay, sleep deprivation is something we can try, but remember, all of them are different. So it's not a one size fits all. If you're going to administer anesthesia, because for me, it's a whole different story. Maybe they're afraid of jabs, etc. So for you, just try be that friend to that child, because some of them maybe are afraid of white coats from experience. If that is so and that's what you're dealing with, just adjust yourself to be comfortable so that they're able to be cooperative. But when you shift that and tell me, make them, you cannot make them. They are just who they are. It's about us embracing them as they are and bringing them to, drawing them to us so that they can feel safe. Remember, at the end of the day, all they want is love, acceptance. Yeah. So even I would like to just take this moment. I just read for you feedback from parents. This will be word to word what they said. I'll just copy paste. So the first one is empathy. I'm not a parent, but I've seen them just break news without being so empathetic. Doctors should know a bit more, read the room and break it down slowly in a language that the parent understands, and share resources for them to read or organizations where they can learn more, like Andy Speaks. We have flyers about autism. Any doctor who wants, we can give you for free. You put them there, then it guides you and takes you through to show them what autism is all about. And then I would like our doctors to improve on the therapy sessions, especially for our stubborn, quote unquote, champions. I mean, they should be patient a bit. Not all. Proper diagnosis of our champs at an early stage and communicating the findings. Educating the masses. What does it mean when a child has been diagnosed with either cerebral palsy or autism? What are the levels and how to deal with each? Autism, on the side of autism, what should the parent know rather than letting families hop from one place to another, not knowing that these are conditions that we have to learn to handle? We want to be able to get medication from public hospital at an affordable price. Let me talk on this medication. A patient called me, or rather DM'd me on my Facebook. Sylvia, I'm in hospital, we are admitted, there is no medication. Please help me. First question, I was like, are you mad? You're in hospital, what do you mean there is no medication? Something as basic as epilim, there is no medication. Judgment aside, because we used to have a program, that means it's a parent, the child, they've been in hospital. I just told our partners, this is the prescription, deliver it to a hospital XYZ. And that was a problem solved. Same thing happened 2 days ago, convulsive disorder. The seizures are not there. The person is in ICU. The hospital does not have the medication. Like, okay, so where else are we supposed to go and feel safe? Let me give you an example of an ambulance. My son was in school. They had never, his convulsions always come in the morning. This day, I don't know for what reason, I was near the school and I decided to pick him early. I am parked there in the playing field, I'm watching. I see commotion at a corner. Then I go to the office to call for him. Then a teacher rushes. Actually, they were calling. They had called the ambulance from that point, and they were coming to call me because my son was having a convulsion and they had no idea what to do. So that means I just removed my heels, hopped through the fence and went and did the first aid the way I know, waited for the ambulance. The ambulance could not access the field, 1. 2, the ambulance did not have oxygen. The ambulance did not have the necessary suppositories to calm him down. I'm like, I'm a parent. These are things I have in my house. You're an ambulance responding to an emergency in a special school. You don't have the bare basics. What are we trying to say? What are we trying to communicate? And we are here to save lives. When we're not prepared for such. If you know you've enlisted for a special school, know exactly what to expect. Injuries, what first aid kits you require. So if I didn't have a car, if I wasn't able to put my son and carry him myself, you didn't even come with a stretcher, you only have the one you can roll and it cannot pass to access the field. Anyway, we would appreciate if doctors, therapists, nutritionists, and other stakeholders worked as a team so that we can get better results in this journey. I think I've extensively touched on that a bit. So there was a question about data. Do we have accurate data? I know that's one of the things that we are championing for, so that data can actually be accessible and so that we at least know the prevalence. Because right now we're depending on the 1:54. Yesterday I had a reporter say 1:60, and I'm like, okay, are we having standard communication somewhere? So we need to get our own statistics as a continent so that we are better. Even if it's as much as our own country, it would be better. Then there is a parent who said, we need to improve therapy time. You don't just massage my son for 2 minutes and then I'm giving back my baby. I have no idea what is going on. I will touch on this a bit more because I have experienced it. After 3 hours of waiting, I came in at 7 in the cold. The baby is hungry, tired, grumpy. We go in, massage. Then I'm told, come back next week. I've not been explained, but it was my first time and I didn't go back. You haven't told me what you're doing, why you're doing it. If you could explain to me, then it's something I can continue doing at home. That means I will be increasing the chances of making this child's life better as a mother. If we are just taking a minute to explain, do this more at home, increase doing this. Some things for speech therapy are things that we can basically do at home, but then no one tells you that. Tell me, do this at home with your child often, it will help. Just learning those basic DIYs, do it yourself kind of things will also go a long way in all of us working together for the better development of and solutions for our kids. Hey girl, this is great take. Diagnosis delivery, we've covered that. Some doctors are rough to say the least. Working with caregivers, support can assist social support, which can handle medical support. So in terms of that psychosocial support, in the process after diagnosis, the one thing we all go through, denial, depression, acceptance. The timeline that will take between point A and point 4 can be even 5 years, can be 10. But all this while we're denying that child the opportunity for early intervention. So that's why we are encouraging that communication, and that if we can be able to just bring a psychologist in by the next time you're coming, bring the family together, explain what it is, break it down gently and slowly. That way you will find it will take some time, but it will take a shorter time for people to go through the denial acceptance process and the depression, because it is real. I also went through it. I know how lethal it can be. But for me now, even for the second child, I was giving myself excuses. Oh, because his brother is not talking, that's why he's not talking. Because he's not having this, or because the brother is not there, because I'm busy, you know. So I was giving excuses. But there is the waking up point when he was going to, I realized he's in the same class for 2 years. He was the tallest in that class. You can imagine 3-year-olds and a 5-year-old, and he's like a giant towering during a sports day, and he could not even do as basic as just run in that straight line. So that was one of the, for my last born, I think that was the height of a wake-up call that it's about time we shift, because I didn't want to think that I would have to. I know I had been given a diagnosis way earlier, and I denied. Even with my loud mouth is talking about this, it took me 7 years 7 good years to accept my last born was on the spectrum, and finally take him to a special school where now he's thriving, he can talk, he's better coordinated, etc. And why we're talking about this early intervention and acceptance is because it makes their life easier. It makes their life way, way, way easier, because now he's able to also associate with his friends, and they love him for that because he's very, very social. Proper what is this? No, diagnosis we've said. The specialists, their consultation fee in their clinics are just too high. I'm not sure every parent can afford 3,000, 4,000, 5,000, 6,000 to take the special kid for assessment and reviews. They've been very specific with the hospitals, but I will not go into that. For me, diagnosis, I feel there is no systematic way of giving a diagnosis in this country. If there can be a systematic way to do this, it took us 6 years to get an actual diagnosis. And even then, it was a different thing to every different doctor. We got diagnosis of suspected autism, just normal developmental delays, another dyslexia, another ADHD, but still, none of the doctors is willing to commit in writing the diagnosis. So we go every day by God's grace. This is just basic with what I was saying. Just tell us. I know it is hard. I know sometimes doctors have don't know how to find it to tell them. Just be gentle or invite someone else who can help you break down the news. No, you don't want to be the bearer of bad news, but sometimes you're saving a life instead of saving emotions. Because sometimes there is a parent who the doctors did not tell them. I'm like, this is Down syndrome. Even me, it's very basic. The symptoms of Down syndrome at birth, even before you can tell. But then we all know, okay, I'm assuming we all know as medics from the extensive research, with Down syndrome, you have the challenges they have: visual, hearing aid, hearing, a hole in the heart. This baby had a hole in the heart and no one discovered. So the child passed on. Yes.
Yeah, sorry, Sylvia.
Yeah.
You okay?
Yes, I'm fine.
Okay, sorry.
Someone had said hello, so I thought there was an intervention.
Yes, because I thought I heard you say, oh, but it's okay. It's okay. You can continue with the discussion. Sorry.
All right. So generally, this child died very early just because there was no communication. And I remember even I saw a parent, we were done for an interview together, and they were saying the child has autism. I know it could be autism and Down syndrome, but Down syndrome was very prevalent from the eyes, from, it's the good thing with DS is something you can see immediately because of the characteristics of the size between the nose, the eyes, the slitted eyes, etc. You can't tell. But why don't, because now someone knows. They say information is power. Information is what makes you do something. But if you don't know, then you don't know what to do. You don't know where to go. So let's just try. It can be hard, but even if it means you will delegate to a specialist to break it down, or call, because most of the time after diagnosis, most people are given my number to just talk to them from a parent point of view, to make them feel at least it's not a dead sentence. But you will find that, okay, I'm also a parent. I also go through the challenges. So it's not something that I can do alone. So it is something that we need to do together. And also be the voice. You spot a child either in the corridors and you can suspect, just candidly, gently talk to the parent, and find out. Maybe they don't even know, and that child is being denied the opportunity to be the best version they can be by early intervention. And then someone will say, let the doctors tell us the truth, as in what awaits us. Then they said counseling to cool our engines. So that's the same thing, psychosocial support. Communication, because sometimes you ask only to be given an answer that will leave you in tears if you're not strong. So I think that has come out very strongly. Communication of what is going on and what to expect. We are very grateful for the services the doctors offer to us. We appreciate that they are doctors and have worked so hard to earn that title. We'd appreciate it if they learn to work as a team so that it doesn't feel like you need from one doctor to another, finding something that sometimes you're not sure what it is. We would also appreciate if they consider the parents' perspective and feedback, especially when our children are admitted, because we are the ones who spend most of the time with them. We would appreciate if the doctors, therapists, nutritionists, and other stakeholders worked as a team so that together we get better results in this journey. This one I had already said also. Then someone said, my take, diagnosis delivery, some doctors are rough, working with caregivers and support groups. And then kindly tell our doctors to try not to allow nurses and other patients on the same beds with our champions when admitted. We are prone to infections, uncomfortable with stairs, and so on. Our champions should be on their own beds in case of admission. This is just basically making room and embracing who they are. They're children, it's a pediatric ward, but remember, they're children with special needs. As an institution, make those accommodations. I know there are days when you're told you're being admitted and you try and figure out how you're going to be in a space with so many people, with a hyperactive child who the minute they feel better is the end of staying in that bed. So some requests of just getting either a corner or getting something that will make it comfortable. It's not for me only or for that child, even for you as a doctor. I'm sure you're there to make life easier and make life better. Those small accommodations, if we make them, then that means our children will be better, get well better, we're just being a bit more understanding. And I know one of the other things is the procedures that are done. Let's talk now admission. The procedures that need to get done. Explain to me what you're doing. Don't draw 10 liters of blood and I'm feeling like my child is going to die because of all these things I'm seeing done or all these things that are being connected, especially when, let's say, you go to HDU, etc. It will take only 1 second to make me also feel confident and make me feel involved as a caregiver as to what is going on. Because sometimes you are there, people are asking you, what did they say? You're like, no one has talked to me. Or you get admitted, you have to wait until the next day for the doctor to come. Then you will be billed for that. Explain to me, the doctor is not here. There is an assistant XYZ who is equal to the task. They'll be attending to you and communicating to the doctor and deciding on what's being done. So for some of us, sometimes we feel like, okay, why am I being charged for a doctor who's not there? I didn't see you, you're my doctor, but you never showed up. It is an intern who came. And the sad reality sometimes is, I'll give you just a hint of, there's a friend who has a child with cerebral palsy, and how the child got cerebral palsy, even for me, I didn't understand it. But she said that we were admitted when we were leaving, the removal of the line was delegated to an intern who messed everything up. Just that small, that small thing that you just did, that small one, removing of the line when you're being discharged, and it landed you back to hospital with a child with cerebral palsy. The other sad stories are during delivery.
Sylvia?
Yeah? Yes, my dear?
Yeah, sorry, I'm interrupting. So we usually have like a Q&A where we have a bit of more interactions with the audience, because I can see we're about to end our discussion. But I must say, I've listened all through and it quite insightful, also disappointing, and also like it opens up our eyes to seeing the other perspective. And truly, that's the intention of this webinar. It's World Autism Awareness Day. And you're right in saying majority of us are not quite aware about what autism is. We know autism is ABCD, but we really don't know how to go about it. We'll give you the best advices and telling you this center is where they have a center of excellence when it comes to autism. You can get the access from this specific area. And I hope and I truly hope the message is going to pass along to every person who's listening, especially the healthcare workers. We are supposed to join in the advocacy program for making sure that people know what autism is, where we're supposed to get the services, what are the guidelines, and what's the government going to do about it. I've met Sylvia, I've met her amazing children. We've sat for, I think, an hour, and I can tell you, she has her hands full. So I totally understand when she says when she comes to the hospital, she just expects magic, But autism, like most chronic illnesses, is heavily dependent on specialists, which we have very few of. I think Dr. Lucy Amolo wanted to shed light. I don't know if Nelson, you can give her a few minutes to speak and give us from her perspective. She's a pediatrician, and she can give us more about the services that are offered. For Sylvia, I remember I asked you, do you take your kid to Kenyatta because you have very good occupational services? and I remember you told me how hard. I remember you told me how hard it is, and you actually made a lot of sense, because I love going to occupational therapy. I take a lot of donors there so that they can build capacity. We've really changed in bringing access to children with autism. And the sad reality, the numbers are actually increasing mostly because of gadgets. So to answer the question, no, it's not purely inherited. It's also environmental. In terms of the gadgets are actually increasing the need for the prevalence of autism in the country. And you're right, actually, people just go there in the morning, because I used to go there in the afternoon and it used to be dead quiet. Never understood why until you told me, as a parent, you can't come here in the afternoon, you can only come here in the morning. So thank you for bringing sight to that. Maybe I can ask you a few questions that have come up from different sides. Where do you think the government can come in, especially us as public hospitals, public facilities? Of course, there are some things we're doing right, and there are more that we need to do, like the ambulance. It's a sad reality. The emergency care policy now, hopefully it's going to be implemented very soon. One of the key things are actually to make sure ambulances are well equipped with the correct personnel who are well trained to handle such emergencies. It was quite a sad event, but where else could we, especially now that you have become officially one of the directors for persons with disability, where can we help there?
Okay, apart from the things that I have mentioned, where we need to see the adjustments, there is the regulation of the specialists, yeah, and also the doctors who need to be held accountable at some point, because some of the things that we see are like, they go scotch-free because you're such a big doctor and you feel you're untouchable. And this is a small parent at a corner. Justice is one of the things that I hope we'll be able to champion for. There are policies that, there is the act being amended. For me, in this capacity as a board director right now, actually why I believe I was placed there is to be the voices of especially the neurodiverse, and at the same time the parents. Because you will find, if you look at the act, for the Disability Act, everything is beneficial to the person with disability. But the reality is, if you do something like the car importation, tax-free car importation, to the living, so that's just hope. I have to take care of them. So as a caregiver, can that come to me? If we look at the implementation, like I've just said, in terms of accessibility, yes, it says that all buildings should be accessible, but then that's a different department in our setup, because sometimes you find even there are some hospitals that some areas are not accessible, and like even some basics like the toilet not being big enough for those who are wheelchair users. And sometimes you will find some of our big children are still in diapers. Have you ever tried changing a diaper in a toilet where there is nowhere to place things? There is nowhere. And the ones that are there are for infants, but then you have an adult, so those are some of the small things that are there, that the policies are being put in place, but we are not implementing them, and we hope to champion for that. The other thing about medicine, we're trying to see if NHIF can do something about it, or even tax, but then we are told as the National Council is an oversight, but then it's like a dog which can bark but that cannot bite, because you don't have powers to actually punish the offenders, So we are hoping to see a bit of changes in that. I know there is a lot of amendments that are in the second reading. The good thing is, at least I understand that we have in the provisional budget from the meeting on Saturday, there was the announcement that there'll be 100 million that will be allocated to the neurodiverse community. And I know one of the duties for me will be to guide and on how best this can serve the community of those with neurodevelopmental disabilities. So those are challenges. We're still being oriented, but once I'm fully in the system and my duties are well cleared, I hope to be of great assistance and use to the whole community and see where we can improve, even on the medical side and the education. Because if you look at the neurodiverse, health, education, social protections go hand in hand. But the difference we find is, even let's take, for example, medical assessment. Where do we go? Basically, it's we know there is Mama Lucy on specific days, there is Mbagathi Hospital in specific days, and then there are the charges that parents are crying to be removed. Because remember, for those with autism, you need more than one doctor and several signatures. Yes, at least finally that signature from MOH has been devolved to the county. But then there is, I know we're at the process of training of now the health workers so that they're able to give proper diagnosis. But one thing that I felt disappointed as a parent was when we were going through the diagnosis of neurodevelopmental, like every other disability was gone through in detail. When we got to autism, it was skipped. And I'm like, we're here to solve a problem. If our own ministry does not take it as serious as it should be, it's just another. And then clustering autism with mental illness, it's not a mental illness. That's one of the greatest things that pain.
It's a developmental.
Yeah, it is a developmental condition. So let us have neurodiverse neurodevelopmental conditions on one side. Yes, we have comorbid conditions underlying, but treat it as such. It's on its own. It's a spectrum. You can't put it under mental. Because when I spoke to Sylvia Kasanga when they were adjusting the bill, I asked her, is there anything to do with the autism? She's like, what is that? You know? That is not part of what we're dealing with. You guys, your issues are not captured anywhere. So we need to also just give it the attention that it deserves and cluster it well. If we don't understand, engage each other, engage the specialists that you have in that area to advise so that we don't do an injustice to those who are on the spectrum.
Yeah, and in fact, we've touched on
Hello?
the next question. Sorry, you can hear me? I hope you can hear me. The next question that I had was regarding advocacy. What areas, or because you see, like you, somehow specialized now.
I'm really straining to hear you. Hello?
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 Yes. I'm not so as clearly as before. I feel like you're a bit far now.
Okay, can you hear me better now?
Best, yes.
Yeah, so I was talking about advocacy. Right now, I can actually say you're a fully fledged specialist. Right now, I can actually say you're a fully fledged specialist.
I am not getting you. You're breaking. You're breaking.
Sorry, let me just stick to one gadget. Can you hear me now? Hello?
Yes.
Hello?
Yes. Yes, I can hear you.
Yeah, sorry, Sylvia. I'm having a bit of technical challenges myself. So I was talking regarding advocacy, and I really wanted you to also give us,
to also give you what?
And things to do about advocacy in terms of our spaces, because it will go a long way, not just in autism. We can just strictly focus on. Over to you, Sylvia.
Okay, there was a time I think it went slow, disappeared. So I've heard advocacy, fully fledged, thank you. But then there is now the main question didn't come.
Yeah, sorry, I was just asking.
Hello.
What tips that you
There's someone else who's also on. So are you able to type so that I can at least see? Hello? Yes, but back to very far. I will just maximize my volume. It's on maximum. Let's see. Okay. Dr. Lucia, I can see you doing that. How are you? Dr. Lucia? I can hear you a bit far, but I can hear. Hello.
Hello,
Yes.
can you hear me now?
Yes, perfect. Thank you.
Oh, sorry. So I was just saying, maybe you can touch a little bit on advocacy, and like the event you had this week, which was all across Africa. Can you tell us how we, as the healthcare workers, we can also engage in such activities?
Okay. Thank you for that question. So through my foundation, it's not a foundation, the organization, Andy Speaks for Special Needs Persons, autism is the key disability that we focus on because that's what I know best, but I try and support all the neurodiverse because we're all walking the same journey and the same challenges. So every year on World Autism Awareness Day, we have a ride where we bring either riders and cyclists. Then we do a procession. So like I mentioned, 2019, we did 19 counties in the hospitals, but then that was one person riding, and then we got the feedback from the ground. 2020, of course, COVID came, we didn't do anything. Last year, we did Nairobi County, and we had telemedication. We had a meds project where we were supplying medication for those who could not afford it across the country. But the main project that is attached to World Autism Awareness Day, which is the gap that we have seen, is education and therapy. So we're trying to equip classes and therapy units so that they're able to offer occupational and therapies that will help the children. So we're doing this as a fundraiser, and we have sponsors sometimes who come. So last year we did Kasarani Primary School Autism Unit, but you see now that also highlighted a different challenge that I'm talking about, cooperation between our ministries. So we built the center. Remember, it's a government school. They don't have the resources. We requested the next dispensary, which is a government hospital. They have the therapists. They don't have the resources. So we said, can't we come together, or can't the Ministry of Health support us with therapists, because we are trying to just support for the benefit of the children. And the sad reality is, oh, that's Ministry of Education. I don't know, at some point there was issues, they stopped supplying therapists. And I'm like, that's basic, very basic. You have the equipment. So we have equipment, but then we don't have the specialists. And when we have a government that doesn't have the equipment, what is so hard in working together for the benefit of the children? And we're championing for therapy being part of education. I sit in KICD, and that's one of the things, Committee for Academic, and as we're going through the curriculum, that's the one thing I'm insisting. Advocacy has to start from when a child is young, because they need to know we are all different that way. Even as they grow up, they'll not be judgmental. As they grow up, when they're making decisions, they'll remember there is someone somewhere who needs to be given a different accommodation. So we start with it when they're young. So education is key, and also equipping. Remember when I was saying massage only, therapy is not just the massage, it is a whole activities. So we are hoping also to know, at least if we have all level 5 hospitals getting well, then that way, if people communicate, this is the gaps, this is what we don't have, then if we run, because throughout the entire month of April. So we are challenging, you can wake up when you're at the gym, say, I'm going to be on the treadmill for 10 kilometers. 2 of those 10 kilometers, I'm going to dedicate for Autism Awareness Project equipping. So that's the challenge of the month. And we're working with Standard Group to raise awareness. So every day we go to the social media of Standard Group and Andy Speaks on Twitter, all across, we will find a fact about autism. So we want to make it a conversation. So how you can come in, you can retweet, you can contribute to your professional side of it. When sometimes we have interview opportunities, we want professionals, but people go like, I'm very busy, but it's part of your work to also educate, to be helping. So those, when we call upon such and the doctor is not available, if you're called upon, because sometimes we want a doctor to speak in mother tongue. I'm Kisi, but I can't speak Kikuyu.
Nice.
Hospital talk about autism, because the other thing we want is that we give the right information. So we need the right person with the right information.
You give the right information. That's correct. That's correct.
Very, very willing to also hold, like I know I did with the USIU psychology class, explaining what is the difference with the mental, and developmental. I'm very open to come and do lectures or collaboration to the right students so that we can make this awareness and advocacy
a more multidisciplinary one.
Yes.
Yeah. So I'd like to give Dr. Lucia Molo a chance to speak. Maybe, Dr. how are you?
I'm fine, thank you.
Yeah, so great. Maybe you can tell us a little bit about you. I read your extensive note, and you can actually vocalize what you said. Over to you.
I'm a consultant pediatrician working in KNH. I'm not an autism expert, but I have interacted as a pediatrician with many patients who come with autism or with signs of autism. So probably, I think Sylvia has really hit the nail on the head when she has talked about the challenges that we have in Kenya, being a parent of a child with autism, the frustrations that you go through. And as she's rightly said, I think one of the biggest challenges we have is coming up with the diagnosis. However, what I can say is that we now have many neurodevelopmental specialists who are coming up in Kenya who serve as good moderators for the patient and the other clinicians. They have good developmental screening tests that can aid in making a diagnosis of autism. Just to mention a few, we have Dr. Wamithi in Aga Khan, we have Dr. Florence Oringe, Dr. Madumadu, Dr. Alia, who I believe are in Gertrude's. We also have others who are currently in training. So hopefully we'll be able to expand the number of neurodevelopmental specialists who can aid in coming up with a diagnosis of autism. So they're a good start, because as Sylvia has said, usually you need very many people involved. You need the OT, you need the speech therapist, you need school. School is very important. So it's sometimes very difficult figuring out school placement for autistic children, but there's a list that many clinicians have. As she said, autism is a spectrum. It can be mild, moderate, or severe. So those who are mild to moderate can actually go to integrated schools. Integrated schools are schools where neurotypical or normal children usually go, and the autistic child is allowed to attend some of the classes, but receives special attention in addition to that. For those who are on the severe end of the spectrum, they usually need to go to special schools such as Kise, Jacaranda, which are readily available. We even have public schools like City Primary that take autistic children. So this list is out there. But of course, as Sylvia said, you need somebody who points you in the right direction. I think another important thing to mention is we have what we call ABA, that's applied behavior therapy. This is the latest therapy that has been proven to somewhat help patients who have autism in developing life skills. Unfortunately, it's not very reachable right now. We have, I think, 3 or 4 available in Kenya. It's very, very expensive and requires commitment. However, we have some ABA therapists who are in training in Kenya. I know of one. She's actually the wife of an obstetrician in Kenya. So in case you need contacts for that, I can point you in the right direction. I think what I can also mention is for parents, as Sylvia has said, the most important thing is to recognize the red flags. And for autism, mainly you'll notice problems with social interaction. Your child will not want to interact with other children. They may not have eye contact. Like if your child is school going, you'll notice that they prefer to spend time on their own as opposed with other children. Delayed milestones are a major red flag, not just motor milestones. Most of the parents, the first thing they notice is speech. Their child is not talking as expected. They also tend to have certain stereotypies or abnormal behaviors, such as hand flapping, head banging, tugging the ears, tiptoe walking. So these are also things that would tell you something is not right. Lack of eye contact, violent outbursts or tantrums are a major issue. And these tantrums can get quite bad, especially as the child gets older. I know of a child who actually threw themselves on a glass table and ended up sustaining quite some injuries. So violent outbursts and tantrums are a big, big issue in autistic children. And as Sylvia said, sometimes you end up being labeled as having a psychiatric illness, but there are actually medications that can help for autistic children. Risperidone, aripiprazole are medications that are prescribed for autistic kids who have very violent outbursts, but we know all of these medications can have side effects, but they can help. Sleep disturbances, usually kids with autism have a problem with the circadian rhythm. So sometimes a parent will come and tell you, mtoto wangu yuko macho, doesn't sleep until 4 a.m., the child is just up and about. So usually melatonin is prescribed for that. However, melatonin is just for initiating sleep, but not for maintaining sleep. So it will help the child fall asleep, but it doesn't assure you that the child will be asleep throughout the night. So you tend to find many parents come with problems of sleeping. There are many sensory issues for children with autism. They don't like loud noises. So there are devices like noise cancellation devices that can be used. Sometimes you'll find that your autistic child will be nonverbal throughout their life. They're actually devices. This is more so in European countries, but they can be brought to Kenya, especially with advocacy, which autistic children can use to communicate. So if your child is having speech problems, it's always good to work with a speech therapist very early. Of course, we have problems like ADHD, depression, which can come about especially in the teenage years for these autistic children. So there are lots of comorbidities that come, including what Sylvia had mentioned, which is seizure disorders. Well, in terms of diet, what I know is that there was a study published by Lancet. I think I saw someone ask about diet. Well, diet is very important. There was a study published though by Lancet about gluten-free diet. They say that gluten-free diet has no association with autism. So I know that's quite controversial because some clinicians do prescribe gluten-free diet, but it has not been shown to have an association. A lot of autistic children who are on long-term medications such as the risperidone, aripiprazole, end up having side effects such as, because these medications can increase your appetite. So you may find that they're having feeding issues and they feed excessively. I think that's what I can mention. Also, maybe what I can mention is there's a lot of information out there. Autism is not just not well understood in Kenya. This is actually a worldwide problem. We've not figured out the etiology or the pathophysiology of this illness. However, there's a lot of resources out there. There's a lot of support groups out there, especially among European countries, where you can actually see what has been done. I'd encourage you to read about the applied behavior therapy and how it has been shown to assist children with autism, such as people like Dr. Cabon, who is a doctor based in the UK who has done a lot of ABA studies. Yes, I think that's what I can mention for now, unless there's anything specific.
No, thank you. Thank you very much, Dr. Lucia, for the brief summary of what is available and what to do. I must say Sylvia, this was a very engaging conversation. You brought out a lot of things that people don't really talk about, but they need to hear, they need to talk about, they need to know how we can make our services better as healthcare professions. And the biggest take-home message is let's be the best advocate for better healthcare. And the best way to do this is by working together from a multidisciplinary perspective, in terms of there's the rehabilitative care, there's the neurology, there's the developmental, there's even the social worker, the nutritionist who are coming on board on all of these things. And usually the trend in Kenya is multidisciplinary can have a lot of gaps, especially in areas whereby you have a little bit of everything. So Sylvia, thank you very much for the very informative perspective from a parent and also from an advocate. Keep going strong. We will light it up blue. Unfortunately, I was unable to join in. However, maybe you can give me your parting shot for the end of the session.
Okay, thank you very much for having me and giving me the platform to share at least what the journey is like. I have a presentation on autism, whatever Doc had said earlier, signs, symptoms, etc. I will share that with you. I will compile the full neurodevelopmental disability signs, symptoms, etc. All of that. That's for the lecture I did in USIU, and then I'll add on the challenges, etc. And yeah, please let us light it up blue this month of April. Anyone who would like to participate, we are working on a portal, by the way, called Special Needs Info Hub. And one of the things, if like the doctors you have mentioned, if you could kindly email me, so doctors who offer these services and are willing, or hospitals, so that we can have it in one place, because at the same, and the schools available also, and like EAC centers and contacts. So we're trying to put all this information and the correct, like what autism is, signs and symptoms, the procedure. So we're doing that. And we would be very happy if we could find a donor to help us. We've done the basics, but we need some insights also sometimes to get this actualized. So at the moment, it's work in progress, and I'm very happy that at least you've listened and taken in. And any questions, you can reach out to Dr. for my contact. I'll be ready and willing to work with the organizations. And like I said earlier, we have flyers that I would be happy if we could find partners who can just place them. It's very basic. It's what we are distributing to do autism awareness day. So generally the description and the characteristics of autism. So we have the language difference, social differences, repetitive actions to watch out for, and the sensory differences. So those are the most common that you will find. So we have quite a good number available. You can give us the platform to share. I will share that, and I can share it also in soft copy. Thank you very much, and do have a very blue, positive, inclusive, accepting Autism Month. Thank you very much.
Thank you very much. Thank you for the audience for listening in, for engaging. We'll continue the discussions. Today we were just focusing on advocacy and also from a parent's perspective of autism. We'll meet again. I believe for me, we'll meet again for the nursing series on Wednesday. And I think there's a session tomorrow. So we meet again. Thank you very much. Bye-bye.